Hello, everybody. Welcome to our webinar with Dr. Jack Zamora presenting on NeoGen and Infinivive exomes. You are in store for 2 hours, and we are going to cover off a lot of educational, a lot of sharing, so you can benefit from getting a really good, solid understanding of both of these very magical aspects of the aesthetic industry. So we're 28 people on so far, and more are going to be joining. We're hoping to get a great number for this auspicious occasion. And I'll just want to say a few words about Energist, and then we're going to hand over to our presenter, Dr. Jack Zamora. So myself, Simon, I'm CEO of Energist. I've been doing the job for 7 years. We're based in the UK. We're the manufacturers of NeoGen. We distribute around the world. We've had the FDA since 2013, and we have 7 indications which are, very, very good in terms of aesthetics and dermatology and post-surgical. So that technology is not a new technology. It's clinically proven. It has so much history in terms of clinical studies, in terms of patents, in terms of track record. It's been around a long time, and it's bubbled away, but now it's really taken off. So the story is started in Asia, arrived in the US in 2017, and that's when Dr. Jack Zamora took ownership of his machine back then, and it's been going really, really well since then. So what do I want to tell you now? So yeah, this is all focused around the US. It's the NeoGen PSR. We have 3 systems, a SPA, an EVO, and a PSR, but the PSR is the only system we sell in the States. And when we're talking about NeoGen, Neo stands for new, Gen stands for generate, plasma, PSR, plasma skin regeneration. We're generating new skin by using plasma to regenerate skin. So a fantastic technology, which is hard to see any other technology doing all the things it does. So okay, I just want to introduce Jack now, who's going to be doing the talking, because I need to get off the stage here. So Dr. Jack is an awesome presenter. He's also an awesome ocular plastic surgeon. There's a lot of people who will recognize him as a leader in this industry. In terms of the world of plasma, he's been there from the very, very beginning. He's been at the roots of the great things that have been achieved with other plasma companies, and he's been at the heart of NeoGen for the last 5 years. So there's nobody better to be talking about the use of NeoGen than Dr. Jack Zamora. He's a great presenter, and I'm really looking forward to this presentation. Jack, I'm going to hand over to you now. Thank you ever so much for your presentation, and thank you to everybody who's on board today. We will have a session of Q&A at the end. We're going to be keeping the chat box open for questions. If we've got Elijah Wheeler from MD360, who's facilitating in the background, and thank you, Elijah, for setting this up. And we'll have a great interactive session. So if we can answer your question, we will. Otherwise, we'll pick it up at the end. So thank you once again for joining us. Dr. Jack Zamora, over to you.
And there we go. Thank you so much, Simon. I appreciate it. Welcome, everyone. I really appreciate you guys taking time out of your day to listen to this presentation regarding plasma energy and some of the stem cell and exosome technology. It's going to be heavy stem cell and exosome initially, and then we'll come back to the devices. My experience comes primarily from the subdermal world. As many of you know, I created the subdermal application of plasma energy for skin tightening.
I'm probably going to just carry on talking just to keep you guys entertained while Jack's sorting out his audio. So in terms of plasma skin resurfacing, otherwise known as plasma skin regeneration, this has, we've got over 500 systems across the world now. dozens of clinical papers written on the technology, and it's a device which can be used from very low energy treatments up to very high energy treatments. So it really can be used for bespoke treatments in terms of lunchtime treatments with very little downtime to the transformational treatments performed by doctors and physicians. In terms of the technology, in terms of how it works, it takes nitrogen gas from a cylinder of medical grade nitrogen gas, and it meets in the nozzle with high frequency. That high frequency creates an environment which ionizes the gas and turns the gas from gas into plasma. Plasma being the fourth state of matter. That matter carries a lot of thermal energy, which when it's pulsed to the skin will deliver that energy, and that energy will penetrate through the stratum corneum and epidermis and as deep as the reticular dermis at higher energies. The temperatures that are contained within that pulse of nitrogen plasma range from anything from 65 degrees to 165 degrees, depending on what energy you're firing. So at the highest energy is obviously 165 degrees C. That pulse of plasma will travel from the nozzle, which is approximately 5 millimeters away from the skin. It will land on the skin. It will not puncture, it will not ablate or vaporize the skin. Instead, it delivers that heat, which then penetrates through the skin, traveling on the water in the tissue or seeking the water in the tissue. Because plasma is not a light, it's not laser, it is a thermal energy. And that mechanism of action is threefold. You first get the skin tightening, which is an immediate contraction on the skin, and that's just heat, caused by heat. The second change you get is resurfacing. You don't get that resurfacing immediately, it happens days later. So the skin the treated skin stays intact. That treated skin is great in terms of protecting the tissues from any nasty complications, bacteria and infections, etc. So it's not an open wound, it's closed off, it's a biological barrier which is keeping the inner tissues very clean and safe. So first you get the tightening, then you get the resurfacing, and then the third thing you get is regeneration, because you are getting energy down into the dermis. So all three of those actions are happening simultaneously on every single pulse. In terms of what the energy level allows the practitioner to do is to determine the right level of energy for the treatment to be performed. That level of energy will then be delivered to the skin, and it will cause damage. There's two zones, what's called the zone of damage and the zone of thermal modification. The zone of damage is skin that becomes non-viable. That non-viable skin will fall away, will dust away or peel away in a number of days' time. And that it can either be a dusting at low energy, or it can be like a peel at high energy. And that kind of time frame can go from low energy of 1 to 2 days to high energy of 5 to 7 days, which really at the highest energy, this system is comparable to a fully ablative CO2 laser treatment. So you're achieving the equivalent results as that aggressive treatment, but with half of the downtime, because the downtime is being halved due to the skin intact. Have we got Jack back now?
I apologize about that, guys. So
okay.
Are you able to see me still? Or can you see my screen?
I can see, we can absolutely see your screen, Dr. Jack, you're fine.
Okay. Where did you guys lose me?
The opening slide, your history of plasma and the history of plasma in the space of dermatology.
Oh, that's terrible. So I'll cut to the chase. Sorry, everyone.
You might have needed the practice. We're good.
So basically, long story short, after working with many different companies and utilizing their products, I randomly ran into Vitro Biopharma, and we created what I consider the best cosmetic stem cell and best exosome products. And these have been measured in the labs, and they're just really phenomenal in terms of the quality of the product within the preclinical measurements in the lab, but more importantly, with respect to the outcomes that we're achieving with our fine lines and wrinkles. It's really remarkable. In short, we have three different products, and I'm just going to bypass this completely, that are all derived from umbilical cord stem cells. And Vitro Biopharma decided to forego or cast aside all of the work that they were doing with adipose-derived stem cells and placental-derived stem cells, because when they were performing these comparative analyses, the umbilical cord stem cells blew away everything compared to what they were seeing before with respect to ATP production, kynurenine expression, immunomodulation, metabolism, migration. So these stem cells were the best stem cells, and the stem cells that they decided to use in their venture towards therapeutics with FDA authorized INDs for other disease processes. And I came along and helped create some of the cosmetic lines that are used in our med spa and many med spas across the US and across the world today. Right now, we're using a cosmetic stem cell product, our cosmetic exosome product, and our daily serum product in conjunction with devices. Once we created these products, I started utilizing these products in conjunction within our med spa. And by the way, this product is okayed by the FDA with respect to abiding by the Food and Drug and Cosmetic Act, where we're taking this cosmetic product, pouring it, rubbing it, sprinkling it on top of the skin, and hoping to improve the appearance of the skin, particularly with fine lines and wrinkles. Our products have been tested against other products and also by third parties, and really they blow everything else away. For example, just the exosomes alone. When we look at the exosomes, all of the exosome companies send these companies to send their products to different quality control places that are independent, and we can easily see that ours are of a purity of greater than 95%, whereas others are barely reaching 12%. And sometimes you can see the significant outcomes on Yeah, and I apologize. I had a number of different slides to showcase the different qualities of the stem cells and exosomes, but I'll cut to the chase. After we developed these products, I started using these products with all of the different devices that exist: microneedling, RF microneedling, CO2, erbium, plasma energy, and the like. And what we found was the most incredible results came along when we started using plasma energy. And it made sense. Plasma energy inherently activates stem cells, whether you're using it topically, whether you're using the plasma energy subdermally. This plasma energy has been scientifically proven to stimulate stem cells. And this is what we have decided to use over the course of the last 5 to 6 years as our principal non-ablative resurfacing device. And the reason that the NeoGen, and first let me tell you a little bit about plasma energy. Plasma energy is that fourth state of matter. It's an energy that can be created by the ionization of a gas. And in this case, we're taking nitrogen gas. We're using ultra high frequency energy, and it's able to activate within the handpiece and deliver plasma energy to the skin. Are you guys on the plasma ionized?
Yes, we are.
All right. And so here's our handpiece right here. And typically we use a more aggressive handpiece at a 5 millimeter distance from the skin. And the neat part is that we've been able to see some really nice improvement in the superficial and deep wrinkles. It's able to tighten the skin. We've seen elasticity improve. But I think the most important part is that the skin doesn't look like it does after CO2 or heavy duty ablative lasers, where after a NeoGen treatment, the skin is still intact. And so it's acting as a biologic dressing. Even though it's still intact, it does allow for permeation of certain products to be put on top of the skin. And then over the course of a few days, whether it's a very low level of energy or high level of energy, you can start to see an improvement in the texture and tone and discoloration very early on. With respect to what we're doing with our NeoGen, it depends. If we're going to do very aggressive patients, we're going to turn our energy up into these two realms, a level 2 or level 3, to deliver somewhere between 2.5 to 3 joules. And as you can see, the plasma energy is going to be delivered to the skin. And unlike a CO2 laser energy that's going to be very direct and it's going to have to penetrate the skin to make its effect or create bulk heating, the plasma energy actually permeates the skin through this Gaussian distribution effect or pattern. And this energy actually carries within it electromagnetic energy, and that energy actually reconditions the skin or almost defibrillates the skin and tells it to start working again. Very, very interesting, the mechanism that through which this does it. At the same time, through that short blast, we're increasing the temperature to create a collagen tightening effect, which is where the initial skin tightening results come from. And so as you're changing, varying the energy range from 1 to 4 joules, you'll have a different penetration of this energy. And depending on that penetration, you're going to cleave the skin. Once that skin has regenerated underneath this cleavage zone, the rest of it sloughs off after a few days. The other great part is, unlike many other devices, we're comfortably using this device not just for the face, but for the body as well. So after doing our skin tightening treatment subdermally, we're adding periumbilical skin resurfacing with NeoGen for that improvement of those fine lines or those wrinkles that exist around the belly button for a better outcome. And the great part about this is, again, unlike CO2 lasers where you're going to have that exposed skin, this is just a little bit of a dermal barrier that exists, epidermal barrier that exists on top of the skin as a protective treatment. The pattern, it's actually a very simple device to learn to use. Unlike light energy-based devices, you don't have to worry about shields, which is a very important part, but you do have to protect the eye, which you do with the wet gauze, and you have to be careful of the hair. Other than that, it's just a very straight pattern of delivery with a little bit of overlap. As within our practice, what we're doing is we start off with a deeper energy treatment first at around 2.5, let's say. And that deeper or higher level of joules is going to allow for a deeper penetration. And we then will follow up with a 1.5 with a more superficial penetration and a 1.0. So we're actually doing 3 passes of energy. The company will tell you that you should do max 2 passes of energy, but done correctly, what we feel happens is we're able to get both the deeper and the superficial complete treatment without any demarcation zones or areas that are missed. Our clinic primarily does single pass treatment, so we're going to be on the high energy level. The only time we're doing the low energy level is when we're doing sexual rejuvenation. In this case, we'll turn the device very, very low and treat the glans penis to improve the appearance of the skin of the glans penis. Now, interestingly, when the glans penis is softer, it actually also has increased sensation. So it's one of that third part of the sexual dysfunction, erectile dysfunction part of the equation in terms of that treatment. Otherwise, we're going pretty hardcore with all of our treatments for facial rejuvenation with the higher level energy treatments. The most important part about this is that you're able to do these things because the FDA has cleared NeoGen for all of these different indications. And so rhytids, whether it's the body or of the face or of the penis, acne scars, seborrheic keratosis, benign skin lesions, viral papillomas, and it's interesting. We've had a number of patients who have had actinic keratoses that have asked us for a NeoGen prior to a blue light treatment, and their skin quality just truly amazes their dermatologists when they go back and cancel their blue light therapies. What's going on with this energy? So once we go ahead and deliver a 3.5 joule energy, that Gaussian distribution is going to be delivered into the skin, and we're going to see an immediate reactivity by the dermis. And so you're going to see all of this activity. A few days later, you're going to start to see this little line of cleavage, a zone of cleavage beginning to develop between the thermal damage and the area that's being remodeled. And over time, after a week and a half or so, you'll see that the 100% of the epidermis has been regenerated. But the more important part is that you're going to see a continued neocollagenesis, neovascularization, and these are the parts that we like to see. Why is that? Because if I try to do a very aggressive CO2 treatment, I'm going to deliver that energy to the tissue. And yes, it's going to cause collagen tightening from the thermal effect, but the CO2 laser doesn't have this additional defibrillatory electromagnetic energy effect that's going to stimulate all of this to happen. In fact, with CO2 energy and erbium energy, the opposite happens. And for a year, you're going to see a thinning of the skin, unlike the NeoGen, where you'll see a thickening, buttery appearance of the skin. The next thing that I like about NeoGen, as opposed to some of our ablative devices, and this is very important, obviously, in today's day and age, is we're not going to vaporize any of the cellular material within the cell. Because we're not vaporizing these cells or destroying these cells are pretty much intact. And so when the skin sloughs off, it's with a normal shedding, these viral proteins remain in here and get sloughed off, as opposed to creating that viral plume that potentially can be inhaled by the esthetician, nurse, or doctor performing the treatment. And then, like I said, unlike the thinning effects that you can get with some of the other devices that are ablative, this device will allow you to continue to see an improving cellular elastosis effect over the course of about a year. Typically, most of our patients see the improvement decreasing at around 9 months, and we don't know why that number is our number, but ours seems to be 9 months. And so it's true, we've pretty much set our erbiums and CO2s to the side for the last 5-6 years, and I, like Adrian Stewart, have moved primarily to nitrogen plasma energy from NeoGen as our go-to for our non-ablative resurfacing treatment. Other things that we've noticed, this is an important part. I don't know, Simon, if you're going to continue to follow through with some of the cancer indications, but plasma energy has been found to cause practically treat cancer preferentially, and that has to do with the fact that when you're delivering this plasma energy, you're creating these free radicals on the skin surface, and these free radicals are very difficult for cancer cells to tolerate, and so they'll go through apoptosis and really disintegrate. And so this is almost like a selective therapeutic treatment, which we've seen very successfully within our patients. We don't, obviously, we're a cosmetic clinic. We don't treat cancer. We don't take insurance, but it's amazing to see the number of patients that are wanting to have this treatment prior to their blue light therapies, like I mentioned before. And this is the neat part. I would say that the majority of the wow treatments come in these Colorado patients for us that have that are Caucasian, that have sun exposure, and that dry solar elastic skin. And this is a patient who had her treatment done. Here she is 30 days later, and that butteriness returns. And I would say that when we apply some of our products, that can be even more dramatic with the improvement of the appearance of fine lines and wrinkles. The downtime is not terrible for some of these treatments. If you're going to be in the medium level of energy delivery, the light energy deliveries at 1 joule are almost no downtime whatsoever. And then our 3+ joules will have some significant downtime. But for the most part, it's not like the fully ablative CO2 lasers or some of the more aggressive plasma devices where patients are out for a month. Here we have the patient at 4 days. Here's the patient at 7 days. So at 7 days, they're looking pretty good. But more importantly, look at that buttery quality of the skin after a few months. Here we are at 30 days. Again, these thin, atrophic, solar elastosis, Caucasian patients allow that electromagnetic energy to travel deep and far and wide, and you get this beautiful response from these patients with very little downtime. And here we are again. Here's 90 days post-treatment. You see the resolution of some of that hyperpigmentation, the red discoloration, and this is a treatment that, again, can be very consistently delivered to patients without any significant side effects, assuming that you're treating within the parameters. And this is the part that I love, just the fact that we're able to enhance our blepharoplasty. And I have some pictures that show, even 3 years later, they come back and you can see where we've treated them and the quality of the skin in that area. And that's after 3 years, not just after 90 days. And then the always difficult one, perioral. For the most part, we still include a little bit of Botox. We still include a little bit of filler in conjunction with our NeoGen to get that maximum effect. However, just NeoGen alone is able to deal with about 60, 70, 80% of the perioral lines. And here you can see 90 days just continuing to get better with this NeoGen treatment. And here again, these patients, again, the Caucasian patients, phenomenal. Significant lifting. This is better than a blepharoplasty can do, truly, because even when I do a blepharoplasty, the skin that I haven't cut out still has this irregularity to it. And so not that our estheticians are completely eliminating my blepharoplasty practice, but they sure have put a big dent into it, which is fine with me. And again, if your patients are allowing you to do very aggressive treatments, and you can get some severe skin tightening with these treatments. However, it's always better to do a couple of these treatments as opposed to trying to do it all in one fell swoop. And I will tell you that in my experience, doing a couple of tiny little CO2 lasers doesn't do what a couple of tiny little NeoGen treatments do. I would say that the NeoGen treatments are more likely to be additive as opposed to the other ablative technologies that don't seem to add on to each other. So 2 or 3 little CO2 treatments does not equal 1 large CO2 treatment. However, the NeoGen treatments seem to be additive. I'm going to try to go ahead and showcase. Let me know, are you still able to see my screen right here?
Yeah, it's all going very well, Jack, in terms of we're following you nicely now. Can I pose a question to you from the audience?
Yeah, go ahead.
Okay. So we've got a question from Hans Kuzel, and his question is, could you go over the differences between J Plasma, Plasma Pen, and NeoGen Plasma in terms of control of the energy, wound care, post-op pain, and efficiency versus other procedures? Thank you.
Right. Well, the first thing that I'll tell you is we are using the NeoGen device primarily because it's FDA authorized for skin rejuvenation or all of these skin conditions. So the reason that I like it is because it's pretty consistent and safe. I was using the J Plasma with helium, but it was just too aggressive to see the results that I wanted to see. And I think I've only done one in the last 3 years, and I was the #1 plasma user in the world. So that just goes to show you how many more subdermal treatments we do with helium plasma. I think the problem with the helium plasma is the amount of heat that's created, and that thermal load is what ultimately creates problems. So you start to see the same issues that you do with CO2 laser. With NeoGen, the protocol is very well made to avoid a lot of those problems, and we don't see much demarcation. Are you able to see this picture that I have here in front of me?
We've got Dr. Adrian Stewart and Trina Barr, 2 treatments picture in front of us.
Oh, that's too bad. I wanted to show this this picture.
Well, let's take a minute.
Dr. Jack, try minimizing that screen and just sharing your desktop and then opening your before and after. Would you mind trying that?
Can you see my desktop now?
No, that screen is, you're still sharing that screen.
So
let me see here. How can I change? Let's see.
you probably need to come out of what you're sharing and click on start sharing the other one you want to share.
Yeah, I'll try that. Anyhow, Dr. Kuzel, I hope I answered that question. It's just for many reasons until a better protocol is made. We're sticking with the NeoGen. It's just so consistent and easy. Plus, we're not going to run afoul of any FDA off-label uses. And again, great. I have access to any device that I want. So.
Excellent. Do you want a couple more questions here, Jack?
Sure. And then while I'm asking these questions, I'll try to
multitask. Yeah. Yeah. Okay. So next question is, how does exomes work as an additive?
Okay. So there's two answers to that. There's the therapeutic answer, where right now we're doing international studies with exosomes that are injected intrathecally, IV, all of these things. But in the US, they can only be used topically for the improvement of fine lines and wrinkles, okay? So when we're using them therapeutically, exosomes basically act like the communicators. They're what are responsible for the paracrine effect of the stem cells. If you inject stem cells into the basal ganglia of a mouse, create corpus callosum trauma, a few months later, you dissect the mouse and the corpus callosum has been regenerated, but the stem cells are still in the basal ganglia. What comes out of the stem cells are all of these exosomes that are coordinating the healing effect that needs to happen for the corpus callosum in those rats. And so similarly, exosomes travel with that mRNA information to create the effects that are intended for a therapeutic effect. In the US, we use exosomes specifically, just topically, for the improvement of fine lines and wrinkles. How's that for a compliant answer?
Very good, very good. Next question, I might be able to answer this one. So we've got a question about, so if NeoGen isn't breaking the barrier with NeoGen, why do we continue to use Aquaphor as a barrier to protect the skin? And I think my answer would be there that the Aquaphor was being used maybe just to an occlusive feel to the skin. You know, straight after the treatment, people might want to just touch the skin, and it's just a deterrent to stop people touching the skin. Have you got Any view on that in terms of why Aquaphor might be quoted in the protocols, Jack?
We don't use Aquaphor. There's lanolin in the Aquaphor, and you can have some patients that develop an allergic reaction to it. But the more moist the skin is, the less dry it's going to get, and the less itching and discomfort. So we use it more so for a patient comfort use.
Yeah, great.
I'm going to leave for a second and come back on if that's okay. I'm going to see if I can just restart the show.
Sure, I'll continue trying to answer these questions then. So next question is, what are the energy used for the 3 passes? So really, it depends on what you're trying to achieve. Jack described that he was using a mixture of energy levels from 2.5 at the start, and then he went to 1.5, and then he went to 1. So that's what he quoted earlier. I would say that our protocols go from anything from a single pass to a double pass normally, in terms of just the number of shots. What's really important in a NeoGen treatment is to cover every part of the skin. So you want, typically a full face and eyes will take about 1,500 shots, and that will give you a complete coverage, and that will be a really good treatment, because you don't want to leave any islands of untreated skin in terms of what you're treating there. So, Jack, I can see you.
Thank you. Yeah, can I see if I can share my screen again?
Yeah.
Okay, let's do this.
I'm going to take one more question, if that's okay, while you're doing that.
Go ahead.
Are you treating patients with darker skin types, skin types 5 and 6? So the NeoGen PSR has FDA indications covered up to skin types 1 to 4, but I know there are doctors that are using the low energy. We're talking low energy for skin types 5 and 6. As a manufacturer, it is marketed with the FDA of 1 to 4, but I know in practice there are doctors using it for skin types 5 and 6, and getting some really nice results in terms of texture tone. Okay. Next question. You kick back in when you're ready, Jack. I'll just keep going here.
Yeah, and I can answer them if you want as well.
Okay. Well, here's the next question. We get mostly Hispanic skin type 4 patients, and we've had a few issues with hyperpigmentation. Besides low energy treatments, what would you recommend when doing energy treatments to avoid hyperpigmentation?
So the way we do it is we will combine it with a different energy. So typically the Hispanic skin, you're typically going after acne, I would assume. And we'll combine it with deeper RF microneedling and a superficial plasma energy. And it works very nicely. That's our workaround so that we're not sacrificing the quality because we can't go as high because of the thermal effect.
Okay, that's good.
Try to share your screen now, your presenter again, so I think you have the rights to share.
Cool. Yeah, I'm just trying to pull up my
Okay, so there's another question which I can answer here. So what is the most aggressive settings for eyelid tightening? Do you need internal eye shields? So no, you don't need internal eye shields. They don't need to be worn by the patient, and the doctor doesn't need to wear protective glasses, and you don't need a laser room either, because it's not light, it's not laser. I know that Dr. Bacharina has recently performed an eyelid treatment at over 3 joules, and she's done 3 passes on that eyelid. So that transformation was to take a very, very lax, very creepy, crappy skin on the eyelid, and it completely removed all of that to make it flat again. So it's basically, you've got some doctors using high energy, some doctors using lower energy to achieve it, but it is safe and it is achieving some great results on the eyelids. Okay, one for Jack here. You mentioned CO2. I think you've already answered this, but the question is NeoGen more effective?
I would say overall, CO2 does a great job. We like it. It's a good device. However, long term, the skin quality is consistently better with plasma energy, with NeoGen, than with our CO2. After a year, you start to see thinner skin, unlike our NeoGen.
Yeah. And so in the early question, it was talking about plasma pens. How, you know?
Oh, yeah. I
Yeah.
see a lot of complications with plasma pen. That's unfortunately way too operator dependent, and that's the one device that we probably fix the most.
Okay. So for you, they're not necessarily comparable in terms of their.
No, it's just no. There's a reason the plasma pen is $2,000 and NeoGen is not.
Yeah. Okay. In terms of anesthesia, what are you using for different energy ranges?
Yeah, we'll use our triple lidocaine cream, leave it on for 45 minutes to an hour, and that's very important because it not only numbs the skin, but it also tumesces the skin and allows for greater distribution of that plasma energy on the skin surface. And then we'll also combine it with Pronox, and Pronox is a phenomenal. If you guys don't have Pronox right now, get it. It's pretty awesome.
Great. In terms of treatment times, what would you say was a full face to perform a full face?
Probably when I do it, gosh, it's maybe 25 minutes. Eyelids take a minute to do. It's very quick. And it's something that you can learn how to do very quickly, meaning your skill set will improve as you go through it. Early on, it's not easy, but you get there.
Okay. How are you getting on with your sharing your presentation?
I'm ready. Yeah.
Oh, excellent. Okay, back to you then, Jack. Thank you.
All right. Is it on? Can you guys see it?
Yeah, I can see it. Yeah, it's good to go.
Okay. So let me see if I can. So I'll just bypass this. Again, the plasma energy has been absolutely revolutionary for skin tightening. And I apologize you can't see these videos, but these are super quick outcomes. And the neat part about these pictures is it shows that that these treatments, for example, this young lady, that's a one-day outcome. And plasma energy does stimulate stem cells. And so when I was doing all of these resurfacing treatments, I figured, okay, let me use the patient's own stem cells to see if I can make things better. And it worked. When I was using a good amount of stem cells, the skin quality improved very dramatically. This is the next day. But unfortunately, when you're using higher level energies on the patients who need it, they need more stem cells probably, and they just didn't have enough of their own stem cells. And so here we see the variability of the quality of outcome when I'm using adipose-derived stem cells. So I went to industry, started using all of these different products, and I used them on our patients, first initially trauma, with stem cells, with amniotic membrane and stem cells, with exosomes, so basically every combination. And again, what I learned was the variability in the quality of the products in the US was very disappointing. Most of the companies who sell stem cell products are not purified and legitimate stem cell products. Unfortunately, the same is also true for exosome products. When we look at our exosome products, the exosome products that we all send to these third parties, some of our samples that we've sent from other companies barely have any exosomes in there, and this is what they should look like. And so when you're buying these products, I started sending them to the University of Colorado for third-party testing, and a few companies for third-party testing, just to see what I was getting, because my outcomes were so variable. And so instead, we use, again, umbilical cord-derived products, just because they are the most powerful products that exist with respect to ATP production, immunomodulation, all of these things. However, we just use them topically for the improvement of fine lines and wrinkles, or the appearance of fine lines and wrinkles. And so typically, with our aggressive treatments, our NeoGens of a high level, we'll use our cosmetic stem cell product with somewhere between 1 to 3 million stem cells. For our very, very low level NeoGen treatments will just use exosomes. For microneedling, just exosomes. For low RF microneedling, just exosomes. For our more advanced RF microneedling, deeper with superficial NeoGen, we use our stem cells. And then we send the patients home with our daily serum, which is a conditioned media with hyaluronic acid. And this is what we've been doing for all of our patients for quite a few years now. And our results are such that we're now in the Four Seasons as their premier product and protocol. Just to show you a couple of pictures, it's pretty neat. Here we take a 20-something-year-old with a thulium laser, a 20-something-year-old with an RF microneedling, and here we take a 50-year-old with both devices, and this is what I look like afterwards compared to what they look like afterwards. And they're still angry with me. This is a plasma pen treatment, someone who asked that, and all you do is just apply the topical solution right on top of the skin. Very simple. This is an Allergan rep. You know, she's got access to all of these great products. This is her a week later after one of our treatments. And here she is a year later after one of our treatments. This is a young gentleman. I love showing men. They don't use makeup. This is before. This is the next day. This is one or a few weeks later. This is 4 months later. It's just absolutely beautiful to see the beautification that you can achieve with these products. And here he is 3 years later. Very, very beautiful. Whether you're using RF microneedling or any of the devices that you're using, I really want to show this in a moment, but you can see a split face of wrinkles on the side where you don't use the product versus where you do use the product. And again, I'll try to play this in a moment. But this is our NeoGen, and this is our go-to nitrogen plasma energy. Is our go-to resurfacing device and replacement for our previous ablative devices. This is a patient that I told you about. Here I'm going to do a blepharoplasty, and then I'm going to do an aggressive NeoGen treatment. Here's 2.5, here's 1.5 down here, and then nothing down below. And here she is post-treatment. Here's that 2.5 joule energy level, pretty impressive. Here's a 1.5 joule level. It's nice, and here's 0. So you can see how effective that treatment is. And this is her 3 years later. Here's that 2.5 layer level treatment. Here's that 1.5, and here's a 0. So even at the 1.5 on this patient who needed a much more aggressive one, you can see that gradation. And it's funny, she hasn't, I'm so happy that she hasn't signed up for full face yet, just because it allows me to see how many years this will last. But nonetheless, what we are able to do now, again, is combine the different devices and get these really wow outcomes with very little downtime. This is a beautiful patient with a lot of laxity, and then this is the skin quality afterwards. And again, multiple devices with NeoGen as our frosting on top, and pretty remarkable. Same with this, just remarkable. We'll bypass some of these. And I was going to show this video. I don't know if I still can with this go-to meeting, but this is what we're able to do with non-surgical, no facelift, a couple little Nomura suture techniques, and then this is our multiple device with NeoGen on top and our Infinivive stem cells and exosomes. And again, this can be done by your nurse anestheticians, and this is what we train our staff. And so what we're doing is we divide our treatment levels with our ablative or non-ablative. So really, I want you guys to start looking at devices that you have sitting around that aren't doing much and use them in combination with your NeoGen on top. It's safe. We've done it for, again, 5, almost 6 years now, and pretty remarkable to see the outcomes that we're getting. With respect to more biologics, for you guys doing blepharoplasties, when our patients are able to have very little downtime, they're super happy. This is a blepharoplasty immediately after. We're going to apply our Infinivive shield on this half of the incision, and here you can see a week later how incredible that looks. The medial side without, the lateral side with, pretty remarkable. And then our facelift. I apologize about that. These are sideways for some reason, but this is what patients want. We're signing up tons of patients because we can show them this is before, this is 5 days later. Pretty remarkable. This is immediately after, and this is months later. It's just beautiful skin quality. This is before. This is the next day, and she's 72 years old. Almost no downtime, and that's what you want to be able to see. I don't think we need to ablate the skin so aggressively. I think we can get some really nice results with less energy and combining energies appropriately. And I think I have a QR code here somewhere for anybody who has questions. Any questions on that part?
I've got some questions on NeoGen, but not right now. Elijah's catching up, so there should be some that come through in a minute because we've got a bit of a delay in terms of getting the questions to me. But me through. So if I could ask a couple of questions which have come through already, which would you say was your go-to combination with NeoGen? Which devices work well, and what are you tackling when you combine them?
So it depends. If I'm doing a non-invasive, I really love Agnes and NeoGen. That combination is remarkable. When I'm doing invasive, I do the J plasma subdermal with NeoGen on top. Those facelifts that we get, I mean, they take us about an hour and a half to do for a full face and skin rejuvenation. And it's remarkable how many patients comment on the skin quality more than anything else.
Great, that sounds good.
All of the patients are happy with the skin quality.
In terms of determining the right level of energy for somebody's face, how do you go about doing that?
So I feel like the closer they are to Fitzpatrick type 1, the higher you can go, and the more rhytids they have, the more aggressive you can be in a way. That energy, those again, the Caucasian, lighter skinned, wrinkly, dry looking skin is amenable to the higher energy levels. And then obviously the opposite is true for the other types of skin.
Okay, great. Do you use exomes with all energy settings? I'm not sure if that's related to NeoGen only or multiple technologies.
So for the answer to that is the more aggressive we are, the more we're going to use our stem cells. The less aggressive than just exosomes. So if we're just doing microneedling, exosomes. If we're doing a light NeoGen, exosomes. If we're doing aggressive NeoGen with multiple devices, stem cells. And then everybody goes home with the daily serum.
And how much of a difference do you think those additives are making to the recovery?
I can show you, if you can, I want to show you a split face photo of an Allergan employee. Again, I love the Allergan employees because they have the all of the products available to them. And so when we can show a difference with one treatment, split face, 3 months later, that's a wow. Again, I think I don't know if I have to sign in and out again to show that. Well, you know what? Let me do this. We can. I'll have to figure that out. But yeah, we can show you some split face pictures that are just absolutely remarkable. So yes, it's enough for us to be able to charge our patients $3,000, $4,000, $5,000 when we do our facials by our estheticians and nurses because of the outcome. We're always going to be able to charge what we deliver.
So Dr. Jack, you're using your exosomes for an inflammation modulation. So you're modulating the inflammation, right? And you're also increasing and boosting the collagen. So the patient's getting, I mean, in terms of their investment, that's two really big, obviously added values to the procedure, correct?
So in the cosmetic world, we can only say that the exosomes improve the appearance of the skin and improve the appearance of fine lines and wrinkles. In our therapeutic world, we're doing other things international. In our therapeutic world, again, we're using our exosome products for intrathecal injections, paraspinal injections, intrafacial injections, a number of things, as well as our stem cells. Those are our therapeutic lines. The things that you just mentioned are all metabolic or physiologic claims that our skin care system does not make. But thank you.
What kind of energy level would you use on a skin type 5 or a skin type 6?
I'm going to use, again, a combination of deep RF microneedling and then a very low level NeoGen 1.0. And again, I've done even CO2 on skin Patrick type 6, but we use these products in conjunction with those patients. And I'd probably use a stem cell product with that patient.
Have you seen any complications with NeoGen over the 5 years?
Absolutely. I'm grateful and thankful that it's not been us. But yes, I've seen complications from coast to coast and internationally. And the biggest issue is just too much energy. This is not a facelift, and you shouldn't be trying to get a facelift result. It's a facial beautifier. It truly does make the skin buttery. And so the complications that I've seen have been 3.5 joules in a very thin vegan lady, for example, where you get some skin necrosis and things of that nature. For us, I mean, again, we've done tons of them. We have nice protocols. I know you guys do trainings as well that we'd be happy to share with, and we just stay out of trouble. Been very, very blessed.
Yeah, I think it comes down to understanding your patient and understanding the energy that can be delivered to that patient for the results that can be achieved without pushing it. But
exactly.
Yeah.
And always bring them back. You know, when we're charging, if we charge our average price for a facial with two devices is going to be somewhere between $3,500 to $4,500, and our estheticians are doing it. I always tell my staff, aim safe and always bring back a patient and treat them for free if you need to. The complication is not worth it. And interestingly, our estheticians are just spot on at this point at delivering.
But you have still been using the NeoGen at the highest energy levels in terms of your
yeah, especially peri-orally. That's where we're the highest, around the mouth.
Okay, and what's that? Is that 3.5, 4?
3.5.
3.5. Okay, great. Okay, I think we might be coming. I'm just checking if we've got any more questions. Elijah, is there any more that haven't come to me yet?
No, you're good. Good.
Okay. Do you want to try once more, Jack, to see if you can find that split slide?
Yes, I do. I think I'll need. Can you see this?
We've got the interface.
Okay, so you don't see a QR code?
No.
Yeah. So for some reason, I need to. I don't know how to change what I'm presenting on our go-to meeting. Meaning, I can't go back out of my. Maybe you can stop me as a presenter. Can you do that?
Elijah, can you have a go at doing that? Elijah, are you there? Are you able to stop Jack as a presenter to allow him to change screens, please? No. One more question while we're waiting, Jack.
Okay.
In terms of body parts, you know, which other parts of the body are you using NeoGen to treat?
Around the umbilicus. So when we do our body tightening, we'll use our NeoGen afterwards to tighten those wrinkles above and below the belly button instead of cutting it out.
Okay. How about scar?
Oh, and the penis. That's an unusual.
Put that one in there.
It works. It's pretty, and it's on label. I love that.
Okay, great. Well, I'll take your word for that one, but it's very, very, very interesting. In terms of the skin scar revision, what in terms of any surgical scars that are created by yourself, you know, how soon would you treat those scars in terms of revising them with NeoGen, or do you use something else to treat those scars? And what kind of energy level are you using if you do treat those scars with NeoGen?
Yeah, I wait as little as 4 to 6 weeks. That's the lowest amount that I'll wait. Typically, by that point, you're able to apply. Most companies will tell you, oh, hey, you do your second treatment 4 to 6 weeks. And that's true. That's when things start turning off a little bit. Truly, if you can wait 3 months, wait the 3 months when the remodeling process is 80% complete. And it depends on what the etiology of the scar. But for the most part, if it's superficial, NeoGen is beautiful.
Does it work well with injectables?
Yes, you're not going to have that much of a thermal load, so you can do your injectable first and then do your NeoGen. Today, for example, we did our fat grafting injections first, and then we topped it off with NeoGen.
And in terms of the when you've got video threads, not that I'm an expert here, but is there any, or stitches in the face?
Yep.
You know, do you avoid those with NeoGen, or are you okay to go over them with a low energy? How do you deal with that?
Yeah, so the stitches that you saw on my blepharoplasty, we'll do the NeoGen over that, but they're all subcuticular, so you're not going to necessarily affect that suture. And for the most part, plasma energy doesn't burn suture. Now, if it happens to be wet, you can get some transmission of the energy through the suture, so make sure the suture is dry, but sutures are not cut by NeoGen necessarily, so you can go right over that. However, again, we use mostly subcuticular, and we've done this with other plasma devices as well, where you can show that it doesn't necessarily cut the stitch.
Great.
Hey, Dr. Jack, I've got three pretty great questions here. There's a lot of questions coming through, but I know we're limited on time. So I'm going to narrow it down to these three. Neck texture and laxity is difficult to treat with any ablative modalities. Would you prefer NeoGen to treat that area versus other treatments?
Yeah, we do both. We do, I mean, you saw my video with the neck laxity and
Yes.
yeah. So we do subdermal plasma energy and external plasma energy. It's all plasma energy. And then skin excision with you can look up Zamora suture on YouTube and find an easy, cheap way of doing a platysmal plication. So we pull the muscle, we do plasma energy underneath the skin. So I do use the J plasma for that deeper ligament tightening, and then I'll use our resurfacing externally. Otherwise, just do multiple neck treatments over time. And again, you'll get that tissue rebuilding as opposed to what we have seen in the past with ablative devices, where a year later, the neck skin, while the first year looked great, after a year, it just looks thin and atrophic, because that ablative CO2 laser energy is non-selective, and it's going to not only tighten the collagen, but it's going to kill the little blood vessels, kill the little sebaceous cells, it's going to kill the little glands, all of the supportive elements, and maybe even the nerves to a certain extent. Whereas plasma energy seems to be more selective and enhances regeneration underneath the skin, so that if I take, actually I've done this, I've taken my CO2 laser patients and treated them with NeoGen, and they look better afterwards.
Okay. Any feedback regarding melasma and NeoGen?
We're still working on that. You know, melasma is an inflammatory disease, and so if we can really control the inflammatory response, then it shouldn't matter what device we use. NeoGen is great in that it allows for the permeation of drugs through the skin, and so we're working on that now. But that's a holy grail.
Well, no question. Last question. How would you treat the elasticity above and below the belly button?
With NeoGen, I like it. It's safe. It's FDA approved. And after the treatment, the skin is not exposed necessarily, and so we're able to put those garments back on our J-plasty body patients. And so today, for example, as a matter of fact, a young lady comes in, looks perfect, except for that crinkly skin above the belly button. And so we'll treat a little quadrant above, apply some stem cells or exosomes, and give her a little a bandage over the skin, just to protect the skin from being sloughed off from her clothes. But even that bandage isn't necessarily necessary. It's only necessary when you're doing these treatments early on, and they're still using the compression garments after your subdermal skin tightening and liposuction.
Okay. Elijah, any more questions from the team?
No, you're good.
Okay. Jack, anything else you want to say?
No, I just apologize about not being able to show a lot of these videos. You know, we'd like to reach out to everyone so that if they have any other questions, we'd be happy to contact you. Or likewise, you can just contact us. And again, it's a pleasure. Simon, thank you for the invitation. And I look forward to working with you guys.
Dr. Jack Zamora, I just want to say a massive thank you from myself, from MD360 and the rest of the NeoGen team and everybody who's on this call.
Hey, Simon, I got a question for you from the outside looking in.
You've chosen to work. And yeah, it's a very honest, genuine, and from a user's perspective with 5 years experience, it's really insightful to hear how you're using it in combination with the products that you've talked about today, which sound like they when they're used with NeoGen and with other products, it sounds like they're a game changer. So I'm really pleased that we're working together with regards to you know, fantastic technology and fantastic product and fantastic users as well. So I'm really deeply grateful for your support, and I look forward to doing more of this with yourself. Thanks for everybody for coming on to this call today. We did have a few technical issues, but I'm hopeful that you've got a lot from this presentation. We've certainly got the last 3/4 of that fully up to speed with the slides and the questions, and I hope we've answered all your questions. In terms of your interest, I believe that we've got your details. There will be an email coming out to you, and we would invite you to get in touch with regards to what you've heard today. And we're very happy to take you through any questions and anything else we can do to enlighten you further as to the excellent things that you've heard today. So without further ado, I'm going to say good night, and thank you once again, Dr. Jack Zamora, for an excellent presentation. Thank you.
Thank you, guys. Bye-bye.